Today we are going to be speaking about how to talk to healthcare providers about sex because most people I work with tell me that they never tell their healthcare providers. Oncologists, and when I talk about healthcare providers, I'm talking about oncologists, gynecologists, primary health doctors, physicians assistants, nurse practitioners, um, pelvic floor um, physical therapists or physical therapists, all the providers who take care of us during our cancer journey. So, most people are not sure if they should bring it up during a consultation. So, I just want to ask you all, what has been your experience in speaking to people, in speaking to your healthcare providers about sexuality? Have you tried? Have you not tried? What holds you back? Let's talk about that. Just put things in the chat about your experience because that's going to help me direct the conversation. Yes. So let me put it here. Practitioners never address. Yes, you're right about that. What has been your experience of discussing sexual issues with health care providers? Never thought of asking them about sexuality. They never ask me either. These are two very good points because we feel as a patient that they should bring it up if it's important. So we kind of hold back thinking that they're going to bring it up. But the truth is, healthcare providers are not trained a lot in this area. Um, and so they feel, so I wrote a paper a long time ago for Medscape on how to talk to healthcare providers about desire. And when I was doing my research, what I found several articles about the reluctance of healthcare providers in talking about sex. So what I learned from my research into all the literature that was out there was that unless the patient brings it up, healthcare providers do not talk about sex. So so unless you bring it up, they're not going to bring it up. And there are several reasons for it. So the reasons that some of the researchers found was a lot of healthcare providers do not get training in sexuality, so they don't understand. Like for instance, oncologists do not understand fully what the sexual side effects are of chemotherapy, so they really cannot talk about it. And sometimes they are embarrassed because they grew up in conservative traditions and they have scripts that say sexual scripts that say that you should not talk about sex. So they are also struggling with inhibitions the same way we are all struggling with inhibitions. So for all these reasons, we have to take control of the situation and we should bring it up first. Okay, so let me just look at the chat again. So some of the things that I not so doctors, okay. Wow, thank you so much for those of you who are putting things in the chat. I really appreciate it. Um, so doctors have certain boundaries and they don't allow us to enter. You are so right. Practitioners never address, and I have never thought of asking them about sexuality. They never asked me either. I've tried to talk about it, but only told me to use more lubrication or coconut oil. See, this is wrong information. You should not be using coconut oil when you're going through chemotherapy. and you're going through any kind of cancer treatment because, oils can trap bacteria. When I did bring up quickly refer to psych professional, well, they can refer to psych professional because that would be a good road to follow, but they should also have some information for you. And one other person says, I tried to ask my oncologist, but she didn't put any interest in this topic. See, if even if they're not interested, sometimes you may have to push through by asking them again. They're not interested because they don't have answers for you. So what you may have to do is to push them to refer you to somebody who will have the answers. But it is very important if five people ask an oncologist about sexuality, then they will be motivated to educate themselves about what are the sexual side effects. Let me say, you know what? I saw three people today. All three of them talked about sexual side effects. This is something I need to focus on. Maybe I can work with an oncology nurse or I can work with a sex therapist and I can figure out a little bit. Maybe we'll have a sex therapist come and speak to our practice group so we can learn more about it so I can help people who come into my office. My surgeon and medical oncologist said nothing about any sexual issues. That is very common. I am so sorry that happens, but that is very common. About 9 months in my treatment, a with my surgeon's office came right out and asked me how things are going sexually for me and has cancer affected it. Good for this person, good for this PA. So sometimes when your oncologist doesn't answer questions, you can turn to the nurse practitioners or the PAs and ask them because they may have a little bit more information about sexuality. They usually give you the resources for moisturizers and dilators, but don't really address the emotional part of it that you have been addressing. Yes, yes, that is very true. Um, at least I'm grateful they're at least giving you information about moisturizers and lubricants and dilators because that is really important medical information. And sometimes they don't address the emotional part, and I'm really sorry, but they should address, even if it is for 5 minutes, because it validates your feelings. It must be really hard. This is sexual side effects are common with this kind of treatment, and just a little bit of validation would be really helpful for all of us. And doctors focus only on organ they are specialized in. You're so right. And the more their specialty, the less they're able to focus on anything beyond their specialty. If it's breast, it's breast. If it is ovary, it's ovary. Nothing beyond that. Nothing about addressing desire, libido, other counseling. It wasn't until I began seeing a woman's health NP, nurse practitioner, about issues with painful penetration that I got help with it. She sent me to a female health practitioner. Yes, this is why sometimes you have to go to more than one healthcare provider to get answers for your questions. Sometimes I feel like they tell me it's normal and don't offer guidance. Yes. Yes, my providers have been great, easy to talk to. I think I would bring it up. Good, wonderful. So we're going to practice how we're going to bring it up before the session ends. My oncologist even suggested dilators. That's wonderful. That's wonderful that they're suggesting dilators. Timing matters, so doctors should save a specific time allotted and planned it out with patient for talking about emotions and sexuality. I absolutely agree. Absolutely agree. I had a good experience with my oncologist. I got a referral to a menopause specialist as well as appointment with an online sex therapist. Great. I'm glad that you got those resources. Doctors should have CE on other platforms and on sexuality so they're trained to talk. The article that I wrote for Medscape was actually for gynecologists. It was so there are some programs that are making an effort, but it's not uniform. So the article I wrote was about how to speak to patients about desire when they come into your office. So that's what I wrote the paper about. I think that's a great idea for oncologists to get understanding and training to feel comfortable in educating and talking to the patients about side effects. They don't have to spend, I know that oncologists don't have a lot of time. They don't have to spend the entire hour talking about sexuality, but even if they could just like for 10 minutes say, you may be having sexual side effects, and these are some resources you can use if you are having some difficulties. We don't have enough time to talk about it here, but I can refer you to this person who will be able to help you. That would be a big help because when there's silence, you don't know, you start doubting yourself. Uh, it wasn't until I began seeing a women's health nurse practitioner. Okay, that I've already read. Treat body as a whole, not compartments as organ. Yes, compartmentalized as organ specialists. Why don't we make suggestion or have suggestion box? We can put our concerns. You were right. I wonder if those of us who have gynecological cancer get more talk about it than those of us with other cancers. That is possible. That is possible that people with gynecological cancers may get a little bit more information. But sometimes that information doesn't come with a lot of resources. For instance, um, I once worked with a person who had vaginal cancer, and they had to, surgically remove part of vagina, so her vagina became really short. So she was told that she couldn't have penetrative sex, but there are resources that will allow her to, her partner was very disappointed, and she was disappointed because she really enjoyed that experience with her partner. So when they came to see me, we started looking at resources. And then, there are certain things. There's something called, um, there's a sort of a ring that you can put on the penis that can help the penis not penetrate too deeply. So those are the sort of resources we worked with, and she was able to experience some sensual sexual experiences. Hold on one second. I'm going to see if I can find that particular box. Oh, here it is. It's called ONUT. So ONUT is a resource that you can think about. So it's what it is, it's a rubber ring that can be put on the penis, so the penis doesn't penetrate as deeply. So it can be very helpful for people who have gone through treatment for gynecological cancer. So this is what it looks like. So there are different rings you can stack on the penis, so the penis doesn't go very deep. So this has been a lot of people find it very helpful, and this was actually um, you know introduced, it was, kind of invented by someone who experienced sexual pain. So let's see, other things. Um, I wonder if those of us who have gynecology, okay, thank you, because my partner feels like the vaginal canal is shorter. So yes, this is a great resource for people whose vaginal canals have shortened. Don't forget about it. This is called ONUT. So I'm going to put it in the chat, and you can just order it. And it's a fantastic company. It's actually owned and run by someone who experienced sexual pain. So she'll talk about that. ONUT.com. I think you just Google it and you can find it. Okay. So there, I put it in the chat. I wonder if those of us who integration of Eastern Western global practice is needed. Holistic care, yes, I totally understand and I agree. Integrated care is very important. I've asked about libido, which is a problem for me. They don't say anything. They sent me to the gynecologist, and she doesn't have answers either. They say it's normal. Yeah, well, it's not normal. I mean, it's normal in the sense it is definitely sexual side effects are part of treatment. It is an outcome of treatment, but we can work on it. There are products that are, we talked about desire last week. If those of you who were not here last week could go and listen to that class we did on desire. So a lot of it is also psychological. We could work on our minds. We could work on our body to stimulate our body so we can experience desire. So you know what? The pelvic floor physical therapy can be very useful because sometimes the physical therapist can also provide us with information about pelvic floor, about sexual pain, about what could be going on. So if you can get a referral to a physical therapist, pelvic floor physical therapist, that would be very, very helpful. So having talked about all of this, how do we bring it up? You know, I would basically say, I've been having, I know it is very hard, especially if it is someone who is of the opposite gender or who is younger or older, whatever it is. We all have our inhibitions around certain people. You will, even if you have to write the script and keep it in your purse and take it with you, you have to bring it up. Because so what research is showing us is when the patient brings up sexual issues, the doctors, the healthcare providers, I'm talking about not just doctors, nurses, everybody, they respond. So we have the responsibility to bring it up, to start the conversation. And sometimes if they say, well, it's normal, you could say it doesn't feel normal. I'm in pain and my relationship is suffering. So, do you know anybody who can help us? So, here are some opportunities for you to find. There are pelvic floor physical therapists that are also sexual health. Oh, Onet is on sale. Good, order it. And there are also um, healthcare providers who specialize in sexuality. So, you may be able to find people online. And please look at ASECT. ASECT is a website that asect.org is a website that is for America. The full expansion of that term. ASECT is American Association of Sex Educators, Counselors, and Therapists. So you can find sex therapists on the website. And you may also sometimes you can find some healthcare providers like physical therapists. You can find some other healthcare providers, nurse practitioners on it. So find somebody like that who can help you. And sometimes you may have to ask your practitioner more than once. So, I'm feeling, and specify exactly what's happening. You need to be able to use the terms for body parts. My vagina is hurting during penetrative sex, or my vulva is irritated. It's hard for me to even wear underwear. So tell me what is going on for me. You know what I mean? So you can kind of bring it up with your healthcare providers and in a very specific way. And even if you don't get the answer right away from them, they may refer you to somebody else. So has anybody had success in speaking to healthcare providers about sex? And what did you do? Why don't you put it in the chat so everybody can see what worked for you? Well, there's a question in the chat. Why are doctors not uh, learning about sex. So um, doctors are not learning about sex because they do not get more than 3 hours on about sexuality, even gynecologists. I used to do grand rounds for healthcare providers. There are exceptions. There are certain schools that spend more time on sex, but most medical schools, nursing schools, do not spend a lot of time on sex. It's kind of, I think it's because it's considered, sort of a frivolous thing. It's not important, but it is very, very important. And the more questions you ask your healthcare providers, the more they will realize this is an important topic that I need to really study a little bit about because so many people are asking me questions about it and I cannot answer it. That's not right. Yes, it may seem like, doctors are in a hurry, they're not paying attention, but I think they want to do the best they can. And I really think the more we push them, the more they will kind of get into they would, spend time learning about it. That's great. And that's great. Thank you so much for the resource that you just provided, pelvicpeople.com. Um, yeah. But there are also remember that, I love these illustrations are very good here. So you can see how it works. So any other questions you have about speaking to healthcare providers about sex? You can also educate yourself about sexual side effects because the American Cancer Society has an entire section on sexuality. Did you know that? American Cancer Society. So you can look on that. Um, managing, yes, thank you so much, Rachel. I really appreciate it. There's a link here that you can look at. So be a very informed consumer. You have to first learn everything about the sexual side effects. These are the sexual side effects that occur with cancer. What are some of the treatment solutions? I have given you a lot of you know, uh, resources. You can look through the resources. You can go to the website, like Sexuality Resources. The website that I gave you information about has an entire section on cancer treatment. It has resources on lubricants, on vibrators, on dilators. It has information on all of this stuff. So, you can definitely try and learn more. Like, let's see if I can find the link for Rachel. Any chance you can find sexualityresources.com and post that link uh, in the chat, please, if you have time. So Sexuality Resources is a website that was created by the way, I don't get any kickbacks from anybody for referring people. Oh, here, thank you so much. You're brilliant. So Sexuality Resources is a website that was created by a physician and a sex educator. So on this website, they have a lot of resources that include an entire section on cancer survivorship. So they have information on lubricants, moisturizers that do not have parabens. So you can go look at it and learn more about, and you can also get samples and you can call them and speak to them, which is really fabulous. I'm so glad that you had that experience. I'm just getting feedback from somebody. I have metastatic breast cancer. Once PET scans were clear and treatment currently deemed effective, my oncology team and I address side effects like bone pain, sleep, and currently specific. Uh, so that's great that that they were able to address things, and I hope they would also address sexual side effects of all the treatments you've had this last week. So one person says, I missed last week talk on desire due to schedule change. Can you share links so that I can watch it all? So what Rachel is saying is all past workshops can be watched here within 48 hours of class ending. Questions about sexual side effects. It helped to work on quality of life issues one by one. I am so glad you had such a stellar oncology team because I think everybody should have the experience you had. It's really important. Um, so do you have any other questions? We have about 3 minutes left. I'll be glad to answer any questions. So we all have been, I know you all have given me feedback that you'd like partners to join. So it is that idea is in the works. So I'm planning a 1 hour kind of a workshop for um, partnered people and even, single people who are, dating and are expecting to meet someone. We could, definitely, address all issues related to relationship. Okay? Anything else? Rachel, did you get any emails or questions that you need me to address?
I didn't get anything from since last week,
Mm-hmm.
but I can put my email in the chat. I always send out the recordings after class, and any materials that Sabia
Okay.
passes along. So if anyone has any questions, you can always email me, and I can pass them along for you.
Okay. Okay. So I hope to see you all next week. I believe the recordings become available 48 hours after the live. Okay. Um, that's good information. And on our website, on the Unite for Her website, there is information about there is the resource list as well, right, Rachel, that they can download and look at.
Yes, yeah, that is with the recording in the description.
Yes, so you can definitely download it and look at, and it's not by any means completely exhaustive in the sense, I'm sure there are other stores and people I didn't know about, but these are the people I have worked with and I trust them. And you can actually, go to their website and order stuff without worrying about it. Okay. So I look forward to seeing you all next week and same time, same place. And I'm just honored that you have made time to speak with me and be here and for participating so much and sharing your experience. I am so thankful. Take care, all of you.